Hey, welcome back to the Live More with Ray show. I know it's been a while, but we have so much to talk about. I'm glad you could make it. Today, I have a special guest, and my guest, Dale Alexander, is going to be speaking to us about something very important. Now, if you're under 65, this may not mean much to you right now, but we would like to speak with you about what's been happening with our seniors and Medicare. I'd like to talk about what Medicare is, what you can expect, all kinds of things that are little nuances that you need to know about when you get older. Now, let me just tell you, getting older is no way an easy journey. Not only are you physically getting older, you're mentally getting older, your social circles are changing, but there are certain things that we need to do, like Social Security and getting our health insurance together. So all of that is what we're going to talk about today. Now, I haven't seen you in a long time. I hope you're doing well. And I just want you to know that the way in which the shows are going to be aired are things that we're going to start talking about, real life stuff, because we're living more, right? We're not only living longer, but we're living more. We're accessing all of our areas in our life, and we want you to be a part of it. We want to be able to answer your questions. We're starting to do workshops this year. We're starting to come out and speak in public forums. So listen, if you need to contact us and you need to find us and let us do certain things for you, please don't hesitate to call. My name is Ray. I am the host. And if you need to contact me, my number is 201-852-4099. You can call me. We can come to your venue. We could talk about things that will be helpful to you. But the one thing that's been laid on my heart really recently is that our seniors are being bombarded with so many different things. The aging process is very complicated and convoluted for the perspective of we've got to decide so many things, and things are moving so quickly. I think our seniors are being left behind. If you have that in your heart and you know what I'm talking about, today's show is all for you. So I want to welcome our guest, Mr. Alexander. How are you?
I am well, Ms. Brown. Good to see you. Good to be here.
Great to see you. So just a little bit about yourself, if you will, and why you're here today.
Well, I am a licensed insurance agent in the state of New Jersey, as well as New York and other states. And I'm here today. I've been focusing in the last few years on Medicare.
Okay.
I'm part of the baby boomers generation.
Okay.
And as I began to approach that 6-0, I said, this whole insurance thing is pretty deep.
Right.
And it's pretty vast as
Right.
well. And by the encouragement of a friend, I had just left one area of my professional life, mm-hmm. and by the encouragement of a very close friend of mine, who I happen to be sitting next to, I was encouraged to pursue my insurance license.
Right.
So I did that and became a life and health insurance producer.
Right.
But as I got more into that area, I became attracted to how Medicare works.
Right.
And as I said, approaching the age of 65 sooner than I would like to.
Right.
But it being right in my face, I said, let me start looking into this. Right. So that has opened up a whole avenue and a whole environment, an arena of insurance information and insurance knowledge,
right.
and how to,
right.
for not only me but everybody in my circle, right. and beyond who are approaching that age.
Right.
The big number is the 6'5".
6'5", okay.
The 6'0" is big as well, but that's more transitional.
Okay.
The 6'5" is really a key number in this country because it's at that time that you become eligible for Medicare.
Okay.
Okay. It used to also coincide with your Social Security eligibility.
Right.
But since probably since about 4 or 5 years ago, your Social Security eligibility is graduated numbers. So
Okay.
based on the year you were born,
Right.
you become eligible not necessarily at 65, but in some cases beyond 65. So
Right.
for instance, anyone born in 1959 now becomes eligible for Social Security at the age of 66, and then whatever number of months based on where they were, the month they were born in.
Right.
But at 65, Medicare kicks in.
Okay.
And what Medicare is, just generally speaking, it is health insurance coverage for seniors.
Okay.
Anyone 65 or older, or anyone who is younger than 65 but has a disability
Right.
that it prevents them from being able to work.
Right, and someone blind as well, correct? That's
Right,
a disability,
yeah, mhm,
but
yeah.
those are the three sect of people that are involved with Medicare.
Right, and
Right.
in those disabilities, in that disability area, the key ones are ALS,
ALS.
which is commonly known as Lou Gehrig's disease.
Correct.
And also end-stage renal disease,
Okay.
which is kidney
Right.
disease.
So I just want to step back a little bit, because sometimes people get this whole the jargon mixed up. Medicare and Medicaid. We're not talking about aid, we're talking about care.
Yes.
Right?
Yes.
And care is mainly hospitalization, correct?
Well, Medicare is a program that's administered by the federal government.
Okay, so Medicare is administered by the federal government.
Right.
Okay.
And Medicaid is a program that is usually administered by the state that you live in.
Okay, and Medicaid is administered by the state in which you live in. So federal government, Medicare, a state government is Medicaid.
Yes.
Okay, good. So then we're just strictly talking about Medicare.
Yes,
Okay.
we're talking about
Right.
Medicare today.
And the big number for Medicare is 65. Step by step, give us a little bit of time to absorb this. Listen, you don't have to take it all in. Just listen to it, and then if you have any questions, you can email us and or contact Mr. Alexander and or contact our show, and we'll be able to put you in contact. We would like to do more workshops so that we can be an assistant and an asset to you and your loved ones. We are tired of people ending up missing, in penalty, whatever the case may be, retiring and don't know what to do and canceling stuff and all that. So we're here to help, right? We're here to
Yes,
help.
we are.
Okay,
Yes,
so
we are.
the next step with Medicare, talk to us.
Even if you're not approaching 65,
Right.
but you have a loved one who is,
Right.
or possibly it may just be a neighbor or a friend,
Right.
the information that I hope we share with you today clearly is something that you want to be aware of. Okay. Because when you were speaking, what I thought is, we all say it takes a village to raise a child.
Right.
But it also takes a village to care for our seniors.
You would not imagine how many of our seniors are left alone, don't have the right medication, don't have the right hospitalization, don't know what to do, and not only that, there are some great families that have just gone all the way out and they have taken care of their loved ones. They're not putting them in different housing or rehab or whatever. But listen, my heart breaks, and I've said it several times, my heart breaks for our seniors. So if it's your next door neighbor, if it's someone down the street, we don't even talk to people anymore. We go up and down the streets. We live on blocks. We don't know who's living there. We live in buildings with thousands of people. We don't know who's there. Listen, this is our community, and we are the village people. Right? We are not the village people group, but we are the village keepers. Would you please, ma'am, sir, lend your heart to help our seniors? Even in the richest communities, seniors go lacking. So let's talk about Medicare, the federal government program.
Yes.
Yes.
Well, as you approach, or as an individual approaches their 65th birthday,
Yes.
their ability to access the Medicare program activates. That is your 65th birthday is the main catalyst for you being able to now access the Medicare system.
Okay.
That access begins 3 months before your 65th birthday, the month of your 65th birthday, and then it carries through till 3 months after your 65th birthday.
Right. So I believe they call that the 313.
I believe so.
Right.
Yes.
The 313.
The
So
313.
3 months before your 65th birthday, the month of your birthday, and 3 months after your birthday. So understand, please, ma'am, please, sir. If April is your birthday, your 3 months before that is January. Then you have April, and 3 months behind that is June.
June, yes.
Right?
July, actually.
July. So please, that is very, 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 very important. You have a time frame in which you have to do something to access what your needs are for Medicare. Good.
Right. Now, generally speaking, the federal government, once you turn 65, will automatically place you into the Medicare system.
Okay, so they do it automatically. They
do
place
it,
you in there.
But you as an individual, or you as a family member or a caretaker, need to be on top of that process.
Right.
Okay. What the federal government provides you once you enter into the Medicare system is they provide you with original Medicare. Those, those parts A and part B are covered under original Medicare. The reason you want to be on top of that process, or the beginning of that process, is that there are qualifiers for you to be able to get Part A without having to pay for it, and also to get Part B. Part B carries a premium with it, or a monthly cost with it.
Okay, so you have so let's back up. So there's a qualification that can be set for you to get Part A.
And Part B.
Right.
That qualification is generally that if you have worked at least what the federal government calls quarters, if you have worked at least 40 quarters in your lifetime, which is the equivalent to 10 years, then you are eligible to receive Part A and Part B. And you're eligible to receive Part A without any additional cost to you.
Okay.
For having that coverage.
Right. So listen, ladies and gentlemen, Mr. Alexander made a very good point. On a yearly basis, however old you are, you can check your work history, right? You can check your work history every year, regardless of what age, and it will let you know how many units, I believe it's units.
Yes, units,
or how many quarters you've worked.
And that's done through Social Security.
And that's done through Social Security. So all of us that do entrepreneurship and that do not, we're self-employed, you must understand, you must have 40, as of today, in 2023, 40 units of work history. If you don't have 40 units of work history, get working now before you get to 65. I'm telling you, no one teaches this. No one taught me. You know, little nuances. Oh, I look at my check. Oh, they're taking out Social Security. You know, you hear this battle going on with the federal government and what they're paying and what they're not paying and blah, 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 blah. And you get 65 years old and you're like, oh, shoot. You know, I didn't work a certain amount of time, you know, blah, blah, blah. And you find out you don't have enough units. Please, ma'am, please, sir, check your units. Please. Okay. Now, we have Part A And we have Part B. Yes.
Right. Additional to parts A and B is also Part D. D is in Delta, D is in Dominion, however you want to look at. Part D manages prescription drug coverage.
Okay.
Okay.
So we have Part A,
Yes,
Part B,
that's correct. And Part D.
and Part D.
And again, Part A covers hospital and hospital facilities, hospitalization. Part B, as in boy, covers your medical insurance, which includes your doctors.
Okay.
And Part D covers prescription drug coverage.
Okay. And I just want you to understand, there is a myth that the government covers everything. People, that is not true. They don't pay for everything. Part B, you have to pay for yourself. Am I right?
That's correct.
There are some exceptions, but understand the exception is not the rule. Okay? So A, B, and D.
Yes.
Okay. Yes.
And A, B, and D are covered under original Medicare.
Covered under original Medicare.
Right.
Right.
And again, if you have all of your units, you will normally get Part A without having to pay anything extra for that.
Okay.
As you mentioned just a moment ago, Part B, you will pay a monthly premium over the life of having Medicare. That Part B normally is paid out directly out of your Social Security benefits.
Right.
Part D
Okay.
is you would pay a co-insurance based on the prescription drugs that you have to take. So again, A, B, and D are covered under original Medicare.
Correct.
On the flip side of that, there is a Part C.
Okay.
Part C is covered under what is known as Medicare Advantage plans.
Okay.
Okay.
So I'm going to keep going over it. Sorry if it sounds redundant. We have A, which is hospitalization.
Coverage.
We have B, which is your doctor care,
Your medical
insurance. C, which is going to be your
Medicare Advantage.
Medicare Advantage programs.
Yes.
Correct? And D, for your medication, your drugs.
Yes.
All right? So, A, B, C, D, hello? Very simple, but very complicated.
So your Part C, which is known as Medicare Advantage, those Medicare Advantage plans are medical insurance plans that are administered by private companies. However, they have to be approved by Medicare, by the government Medicare oversight.
Okay, so they are private companies that have programs that assist us. However, they have to be approved through Medicare, through the
correct.
federal government.
Yes.
They have to be approved. So that means you got to be aware of what these companies are offering, right? Are your doctors covered? Are your prescriptions covered? Blah, blah, blah,
So
blah,
on
blah.
and so forth.
So on, right.
Yes. And again, those plans, what they're designed to do is to fill in some of the gaps or most of the gaps that are left through original Medicare.
Okay.
They're designed to fill in those gaps, and also as they continue to develop, to provide some additional coverage for things that original Medicare does not cover. In terms of your medical coverage, for our seniors, much of it is predicated on their income. And of course, as you're a senior and you go further and further into beyond your retirement, your income tends to plateau. and in some unfortunate cases even recedes from what it was at the best level.
Correct.
So original Medicare,
Right.
There are costs besides your premiums for your Part B. There are costs that will have to be covered under original Medicare.
Right.
Those costs are generally about 20% co-insurance payment for whatever coverage
Right.
or whatever services
Right.
you get through
Right.
by using original Medicare. If you choose a Medicare Advantage plan or a Part C plan,
Right.
they have designed them to be less financially intrusive.
Correct.
Okay? However, you've got to do your homework.
So you were saying we have to be very attentive.
Exactly, and I say that there is the government website for Medicare is Medicare.gov, and make sure for information, if you want to pursue information on your own, that you go to Medicare.gov. Okay. However, what you will find, even with the Part C, is with those plans that are designed to help you not have to expend so many of your finances
Right.
for your medical coverage. There are for instance, in the two of our largest counties here in northern New Jersey, Essex County and Bergen County. In Essex County, there are 38 different Part C Medicare Advantage plans available. Be willing to sift through
Right.
what's going to be best for you, because finances are so important
Yeah.
in this area.
Yeah.
You may see a plan that, and many of the plans these days from the private companies have what's known as $0 premium plans. So you don't have to pay anything monthly just to have the plan. However, though that might be an attraction, it may not be the best option for you or for the senior in your life who you're serving. A few key things to consider. I mentioned the election period right around your 65th birthday.
Correct.
That's known as the initial coverage election period.
Okay.
There are two other very important election periods where you can choose or either your initial coverage or you can choose to change your coverage.
Okay.
And each year there's what's known as the annual election period. That occurs between October 15th and December 7th of each year. And for you seniors and family members and caretakers who've been through that already, you will note that there's always an uptick in the in Medicare information you start receiving in the mail,
right,
and that you start seeing on television,
right,
around that time.
Right.
So that's probably one of the most important time periods every year.
And what are the dates again?
The dates are October 15th through December 7th.
Now, I have to tell you, I've heard this before, but I don't know who picked those dates. I don't know whose birthdays those are, but who's thinking at the end of the year, the last quarter of the year, of October 15th and December 7th? I'm getting ready for Christmas.
Exactly.
You understand? Summer just ended, pretty much. You know what I mean? So please, ma'am, please, sir, put on your calendar those dates. October 15th and December 7th. And that is the annual
election period.
The annual election period. Next.
There's another election period between January 1st and March 31st. It's about to end tomorrow. That's called the open enrollment period. And that is if whatever you chose in your annual election period isn't really working for you,
right,
you now have the opportunity between January 1st and March 31st to make a change, but it's only a one-time change for the year you're in. So the 2023 open enrollment period ends tomorrow. And if you needed to make a change or wanted to make a change, you had one time to do so during that 3-month period. There are other exceptions, but those exceptions are based on different criteria.
Okay.
And there's a lot of different exceptions, but generally speaking, if you miss it on by March 31st, you got to stay with that plan until you got to stay with that plan through the end of the year. But your next option to choose a different plan is October 15th.
Right.
And then the last thing I would share with your viewers is that if you're going to be working with someone who does insurance, who does Medicare or specializes in Medicare, be certain that they are a licensed insurance agent in the state of New Jersey.
Or in your state.
Or in your state.
Whatever state you're in, because
exactly.
This show may end up in North Carolina.
That's
but
right.
Make sure the person is licensed in your state.
Make sure they're licensed in your state.
And the reason why?
And the reason why is because they will have been, they will have gone through the necessary certifications,
right, in
order to assist you with making a choice for a good choice.
Right.
And also, in addition to them being a licensed insurance agent, and this is a feeling. Make sure they have your best interest in heart as well.
Right.
Because your selection for any medical coverage, particularly your coverage as a senior and as a retiree,
right, is
what is best for you.
Make sure the person sitting next to you has you in mind. That's the bottom line. You know, and just because they call you honey, sugar, and dumpling doesn't mean they have your best interest. They need to be able to articulate what they hear your needs are. Anyone come in the door, start telling you what you need before they ask you and assess what you need, tell them bye. Because we need to hear you, listen to you, so that we can gain from you what it is you need. Because when you go to the hospital, when your caregivers take you to the hospital or to the doctor, they are the ones that have to deal with this insurance piece. They are the ones that have to deal with what you've purchased. So please, ma'am, please, sir, don't be afraid to articulate what's going on with you. And seniors, you don't have to be ashamed. You don't have to hide. Whatever your needs are, we understand that there are great big changes. Things aren't the way they used to be. And guess what? They're not going to go back the way they used to be. So in this process, in this journey, articulate your needs. There's no need to be ashamed that you can't take care of certain things anymore if your health is diminishing. But I do say to you, if you're just sitting there watching television all day, of course you're not going to be able to breathe. You need to get up and do some exercise. You need to stay involved. If you're used to going to work every day for 40 years and then all of a sudden you decided you're retiring and that's it, you need to be able to be still engaged with doing exercises. We definitely love you here at the Live More with Ray show. We are definitely here to talk about you and the support that you need and your family's need. Please, ma'am, please, sir. This is not the only show that we're going to be having. I plan on doing a couple more tapings with the information for seniors. And again, we are available for you. We love you much. And we hope and pray that we've answered or helped you in some kind of way. God bless you and talk soon.